At the beginning of the season, in the second game, I hurt my knee, and I rehabbed that. I tore my MCL. I rehabbed that, and I came back. My first game back was the San Extremity game, and I was playing good, and I went and I was making a tackle, and the running back went this way, and my body was going that way, and it ripped my shoulder out of socket and tore my labrum, and that dislocated my shoulder, and then I had that wrapped up, and they said I was good to go back out there and play. And I walked back out there, and the first play went out. It came back out.
The shoulder came out of place after a severe hit. We put it back into place on the sideline, and we braced him, but he continued to have symptoms of it wanting to slip out, and that was the reason why he had to end the season. A shoulder coming out of place can sometimes be treated just with rehab, depending on the severity. But in some cases where the cartilage in the shoulder is torn, you can't really get that stability back without a surgical repair. To help protect against injuries, we want the kids to be as strong as possible going into their sport. A lot of the prevention of injuries is through being ready to play the sport and getting your body strong, getting fast. Clay is a special athlete in that he has the genetics and the build and the will to go on and play at a Division I level, possibly have a scholarship, and continue to further his athletic career. Usually I tell the kids that return to sport is 4 to 6 months after this type of severe injury. And if he follows our directions and he continues to progress as we expect, I expect to get him in the weight room and getting his athletic strength back, not just the rehab side of it, but getting back to football shape starting at 4 months post-op.
I feel like my surgery went amazing. I basically have no pain in it now, 4 weeks after it. Dr. Kuiper said they put 4 anchors in, and everything looks good. The best part about working with Dr. Kuiper is he cares so much about his patients, and he knows that it's not only just patients trying to get better, but it's athletes trying to come back and be able to perform at the highest level. And I really think that a doctor who understands that is very advantageous to an athlete that's trying to come back and trying to be able to play high school and maybe even college athletics again.